Kia ora koutou and welcome to eHealthTALK NZ. I'm Rebecca Macbeth. I'm the media editor at HINS, and I'd like to thank Hendrix Health and Heidi Health for sponsoring this podcast episode where we are exploring the use of the Heidi AI medical scribe across New Zealand's largest independent primary healthcare group, Tāmaki Health. So discussing this, we have Tāmaki Health's Chief Digital Officer, Samir Ranchod, Deputy Clinical Director, Slushna Weramuni, and GP and Urgent Care Doctor, Jamie Farr. So welcome on the show, Sam, Slushna and Jamie. Can you start by telling our listeners a bit about your involvement in rolling out Heidi at Tāmaki Health? Starting with Sam.
Thanks, Rebecca. I'm Sam, Chief Digital Officer for Tāmaki Health, and what I was tasked with is leading the program for selecting and rolling out AI Scribe across the organisation. And that involved pulling together a project team that consisted of clinical, operational and digital team members. And part of the process for us was piloting multiple solutions which informed our selection process. And we really wanted to land with someone that was an AI Scribe strategic partner for us, where we could really evolve and leverage the technology as the technology changes over time.
Kia ora, Rebecca. Thanks for having us on. I got involved with Heidi a year ago when Sam mentioned it, and I had a look at a video online first and was just so blown away. I couldn't wait, and I downloaded the free version and started using it straight away. And I actually found an email in preparation for this where I had written to my GP peer group saying, today my life changed, and encouraging everyone to look at that. And that was even before we got onto the pro version, which was in November last year when we integrated into Medtech Evolution. I then got the rest of the practice team involved in getting it going, and then worked with the working group that Sam had set up with the Australian developers along with Jamie, and shout out to Sarah Stuber, who's our Heidi lady at Tāmaki, also going around in my job visiting the West Auckland cluster practices and just picking up where the clinicians needed extra support, or if they weren't set up with things like microphones or they hadn't heard about it, I would reach out to Sarah and she would then go along and to help them set up, really.
Great. Yeah. So important to have clinical champions like you in these sorts of projects. And Jamie, how about you?
Hi, Rebecca. Thanks for having me here. So, my name's Jamie. I'm one of our GPs and urgent care doctors at Tāmaki, also the Deputy Medical Director at one of our larger integrated clinics at Whitecross. So I've had experience with using Heidi and AI scribes, both on the sort of leadership side, helping to integrate them, as well as on the kind of shop floor in GP and urgent care. I first came across them, I think, when in a meeting when we were talking about using dictation software, and I felt quite strongly that we were wasting our time and rolling out technology like that would probably be obsolete in the near future. I was already using different types of AI scribes in my own practice at the time, and just felt they had a lot more to offer us. So tried to push quite heavily to get us using those, and I was really, really glad when we did start to adopt them. In terms of how I've helped be involved in the rollout here at Tāmaki, I've gone from speaking to our clinicians out in the clinics, seeing how they think it could help them, testing different microphones like desktop mics versus lapel mics, depending on the setting that we're working in, and just trying to help develop some of our custom templates as well, so we're capturing all the information we need.
So, Sam, you did touch on it there, but how did you go about selecting a medical scribing tool to implement, and what policies or procedures did you have to put in place before actually rolling it out?
Thanks, Rebecca. So one of the things that's really a key pillar for our digital strategy and the organisation strategy, I suppose, is we really wanted to work on focusing on clinical workflow automation and optimization. And so when we started looking at AI scribes, we knew that this was a technology that would help us solve a component of that. And so we started initially, naturally, when you're dealing with any technology that has the word AI in it, there's always the privacy impact assessment that really starts first, because we're talking about patients' clinical records, etc. And the way that we went about that is we piloted 3 to 4 technologies across a pilot group, and we rotated the doctors and clinicians across those 3 or 4 different technologies, and then obviously gather their feedback. And then the other important part was to understand with all of these players and quite a new emerging tech in the sector, is what was the depth of their product roadmap and what did it look like going forward over the next year or so. And obviously, because it was a evolving technology, it was really hard to see what this looks like at that time, 3 years from now. So we gathered everyone's feedback and we looked at the capability and then the potential for integration into our patient management system, which was really key for us, because we think that once you have that in terms of its current capability, the next bit that creates even greater efficiency for integrating it into the PMS and building out some additional workflows. And one of the things that we looked for with our vendors in the selection process is Tāmaki, when we adopt tech, I suppose the best way to put it is we're not necessarily passive recipients of tech. We like to get in and actively create a partnership with the vendors and then have the ability, I suppose, to influence the roadmap and the future of those products, not just for our own settings, but it obviously has a wider impact to the sector as well. So that was critical to our selection criteria. And then once we had developed a close relationship with Heidi, we established a steering group. And that steering group basically went through the processes of developing consent policies, the actual framework for the way that these notes are reviewed before they enter the patient management system, all of the traditional material that's created around a program of work around training, FAQs, signage for our waiting rooms, and then obviously the consent process and the opt-out process for our patients as well. All of that put together is what we developed as a program. And then we really, to be fair, leaned on our clinical leads and our teams, and also some of the people that had been early adopters of the technology as well.
I mean, introducing AI into clinical documentation can be sensitive. So how did you address any initial apprehension among clinicians? And has that sentiment or feeling shifted over time?
Yeah, look at, I think, introducing particularly the word AI into any area that touches on clinical notes is probably one of the most sensitive areas across our business, and probably, in fairness, historically been one of the hardest places to innovate in, just simply because the patient management systems haven't really changed in that space for a number of years. So the way that we thought that we would be simply the most successful is actually getting our project teams into the clinics, and that really paid off. And we've seen a really big shift in terms of people sort of understanding that the product is intuitive and it provides almost an immediate benefit. And as soon as clinicians saw that, we saw a mass shift in terms of sentiment straight away, to the point where, it's very common for me to be in clinics and clinicians providing feedback saying this has changed my life, which is when you know you've got it right.
Yes, Lashana, that's what you said as well. Did you have any apprehension, or were you always keen, and how have you dealt with your colleagues or others' potential concerns?
I've always been keen, and Sam touched on some of the issues really well. And the main issues when talking to people was with regards to privacy. And so I would say to them, look, you need to get the patient's consent, and you don't have to identify the patient on the program because you don't need to put their details in, so it can remain anonymous, and you can copy and paste it into MedTech, which is our practice PMS. So that reassured them quite a bit, really. And people felt like they might have a bit of loss of control where the AI scribe would take over what they would do. But I would say, look, you can go in and edit it. You can add your own things in there. You can change things. And once they started using it, as time went on, it's become invaluable. You're not going to go back once you start using this.
And Jamie, how about you? Were you always keen to jump in? And can you also talk about how Heidi's changed your day-to-day work and interaction with patients?
Yeah, I was keen to get started with Heidi. I think one of the biggest things for me in my day-to-day is it's freed me up to be more of a doctor and less of a typist sat there at the computer. There's always a temptation when you're in the consultation to be turning back to the keyboard to type something in that was vital or an important bit of information that the patient's told you. It might be a blood pressure recording that you've taken, or the patient telling you that their father maybe had a heart attack at, was it 56 or was it 65? Quite important, but you can't necessarily always remember that at the end of the consult. So knowing that if it's discussed in the consultation that Heidi or any scribe tool has heard that and then will put it in the notes accurately is really, really important. So it shifts away that concentration from sometimes being on the computer straight back to the patient. I think it's really helped with my presence in the consultation and eye contact with the patients. And certainly I've had some feedback saying that as well, that the patients where I've told, especially early on, that I was using this, just said that it was great. They just felt like it was more of a conversation that was happening rather than being interrupted with technology.
Clinicians talk a lot about it reducing their cognitive load. Has that been your experience, Lashna, with Heidi? And can you share an example of how this has improved your practice or your patient care?
We are seeing more and more patients with chronic, complex comorbidities. They don't just come in with one thing anymore. We now have to write a huge thing about the history, the examination, and management plan. And so it captures it really well because of that. And especially with the mental health patients, like Jamie said, you're not looking at the computer, you're totally engaged with the patients. You can pick up on nonverbal cues. And it gives you a really detailed transcript of what's been discussed in the consult, the advice you've given them. With the new improvements, it gives us a task list. If you say, I'm going to send you to see a specialist about your rash, your heart problem, you need some lab tests, you need some x-rays, and that's all there, and you don't have to remember it and jot it all down as you go. Sometimes you see what we call as balance at the heart sync patients, 2 or 3 or 4 in a row. And you can now deal with them and just move straight on to the next patient, but leave the notes at the end of the day because they're captured on Heidi. Just a quick example, on Friday night, it was my husband's birthday and I had a table booked at a restaurant, and I'm always late for things. And I thought, no, tonight I'm going to make it. And 10 to 7, as we close at 7, 10 to 7, my clinic coordinator says, Sasha, can you please ring this patient? She's really desperate to talk to you. So I bring her, and she's got a massive problem with her right leg where she's had 3 separate injuries over the last 2 or 3 months, and she's seen 4 people, including me, and she's had multiple issues with it, and she's had 3 separate ACCs done. And I spoke with her for about 20 minutes, and that would have been a 15 minutes to write up that consultation, and I probably would have got some of those things wrong. And honestly, it took me 2 minutes to edit the notes and get out of there, and we got to the restaurant in time.
Yeah, absolutely not having to worry about typing all the notes at the end of the consultation and go through everything again sometimes is brilliant. But also, we're trained in a way to take a history and do the examination, form an impression and differential, make a plan, all in quite a strict order. But we all know that when a patient walks into the room, nothing follows that order. There's bits of information that come up in their history that then later in an examination, they may tell you something else. So it takes away some of that cognitive burden of trying to sort everything out and where it's going in your head. All that's going to be done. It's all going to just be put under the right heading in your template. It frees you up to then spend a bit more time with the patient, actually talking about their return to work plan, discussing the safety net advice in lots and lots of detail, telling them the red flags to look out for. And all of those things are going to be recorded exactly as you've said them. So you're not going to have to spend time after the consultation writing out all of those things individually. So for me, I find it's taken away time at the end of the consultation just in front of the computer typing and given some of that back to the patient, which is brilliant.
So, Sam, when Tāmaki first considered adopting an AI-powered scribe, what benefits were you expecting? And has that been the reality from a clinical and organisational perspective?
I think that when we first started, it was very academic. So in all transparency, we thought, reduction of time in a consult, accuracy around notes, and just general efficiency. But to the points earlier, what we've really seen is the other benefits that have come through. So it's really been around that reduction of cognitive load, the experience that the patient has in the consult room where they just feel that they've had a consult where that has just been more interactive. Often the words are, I was really listened to in that consult, and they feel a lot more comfortable than talking through other parts that might relate to that consult to help the clinician as well understand the bigger picture. So that's what we've seen. Certainly, a lot of people will say to get to the restaurant early, as that example is perfect. The ability to even also park something because you have the confidence that all the notes are there and you can revisit it at a later date. So a lot of our benefits, not necessarily in consult time saving, have been outside post consult, how quick it is to wrap up the admin components of those particular consults. So that's probably what we've seen. And in general, I would say that all of those benefits that we perceived initially, we've realized, but there's also been those non-tangible ones that have come across as well.
And Slashna, what's been your experience of what you were expecting and what it's actually delivered? I guess looking long term, things like being able to get to your husband's birthday dinner or spend time with family or do other things must have a positive long term impact on people staying in practice and all sorts of other things in terms of their lives.
Yeah, absolutely. Wanted to look at it really for the time saving issue. We did have, to be fair, some initial teething problems like you do with everything. There would be some hallucinations. You would get the right and the left side would be wrong. And it was really a little bit of a learning curve of saying you're describing things. So the patients would come in and say, oh, I've got a pain here, then it goes here, and then it goes down there. And you'd say, oh, so you've got a pain in your neck, goes down your left arm, and then it went to the back. And I think that's been quite beneficial for patients because they feel like you've listened to them, you've understood what their symptoms are because you're reflecting back to them. And working with the Australian team, with the working group, it's been amazing moving on to the pro version, and the improvements they've done have been just really incredible. It's just so detailed. It really does blow your mind, really. From an organizational perspective, because we are integrated, we can see the notes of the Tāmaki clinics and the White Cross clinics right through the network, which is a huge benefit. So when patients have been to, say, urgent care after hours, or they've been to another GP because they can't get an appointment with us, then you can see what's happened. You can see what the examination findings have been, what the symptoms were at the time, what the management plan is. So you can then expand that or implement that if they haven't already done that. So it's just keeping things consistent, and it's really improved the quality of our notes so much, really.
And Jamie, you talked about creating templates within Heidi. Can you talk about how you've gone about that and customize them for different clinical settings? And how have other clinicians sort of engaged with that process and the efficiencies it's created?
So, yeah, I have been involved with creating some custom templates in Heidi. And initially, that was just to make templates that allowed all of the information in the consult to be presented in a logical way, with your presenting complaint, your history of presenting complaint, medical background, examination findings, impression and plan. And most of our clinicians liked starting off with that, which was a generic kind of template, so everything could be seen and handed over to the next person easily. But over time, I've found that a lot of our doctors have wanted to go in and customize that further to make it more personal to them, which I think is really important because, you know, our notes are quite personal. There are some things that we like to include, whereas other people might not. And allowing that customization's is really key. So now I've got people that are preferring to make different templates for certain types of consultations. They might be more complex mental health consultations. I've got templates set up for those quick, very easy review consultations. So you don't get a long note produced, you just get a quick summary with ACC and injury presentations. Set things up so we're making sure that we're recording like the sizes of abrasions, what type of cast maybe was applied to the patient, things that can really help our admin team with the claiming further down the line, all the way through to sort of full skin cancer checks and things that may be presented in a different way. So yeah, there's so much ability to customize it and turn it into anything you want, really. We've also been adding in some things to help with medtech screening for blood pressures and things like that. It's really endless what you can do with them.
So you've both spoken there about how Heidi's changed the quality and the structure and the completeness of the clinical notes. Sam, can you just talk more about the impact that that's had organisationally and, you know, what it means you might be able to do in the future as well?
Yeah, definitely. I think the biggest thing that you have here is when the notes are being generated by AI Scribe and Heidi, you're now getting notes in a uniform structure across the group. And what that really allows us to do is our ability to take that information or that data in a structured way, build out a whole lot of automation processes based on that by having the ability to pick out keywords or something like that across the clinical notes. So that's probably been one of the biggest advantages. Certainly at a group level, the other one that we see as a significant benefit is just around our complaint management, just because of the enhanced accuracy of the notes and the detail that it goes into. It just provides clinicians as a whole the confidence that those notes are there for recall and anything that might pop up. And then also we've had a little bit of feedback around patients who do choose, and there's not many, but some do review their notes in patient portals across some of the settings that we have across the group. So we've had a bit of feedback there in a positive way around the improvements that that's introduced, just with their ability to review those notes and understand it in a patient-centric method rather than a clinical note that might be quite short word previously or keyword driven. And then, really for us is this technology, I suppose, is in the last 6 months at ground level. And so if you think around what that might look like 1 year from now, 6 months from now, I think there's a lot of opportunity for us to improve just around enhance the care for patients and clinician experience. So that's where we've been working with Heidi around what that might look like, future state for us as well.
And Slashna, what feedback have you had from patients, both around consent, Sam just mentioned there, and the experience of being in a consultation with an AI scribe active?
Yeah, I always ask them, and now the patients have come in regularly because I've been using it for a while. They'll always say, "Oh, yeah, you asked me about it last time." But the initial response when I've explained it has been things like, "Oh, cool," or "Whatever makes your life easier, doc." And sometimes if they're a little bit skeptical, that can occur because we have such a multicultural and diverse group of patients. I do take the time to explain it a little bit better, but also I don't think we've mentioned that Heidi is multilingual as well. And just in the last week, actually, I speak Sinhalese, a basic level of Sinhalese where I can conduct a consult. And for the first time, I spoke to the patient for the entire consult in Sinhalese and switched on the translator. And I just got the whole transcript in English, and it was so accurate. And that was actually really good. Nobody's really said no, except for people who don't really understand the technology and they think it's going to be used in a negative way. What I've done with some of those skeptical people is I've shown them what it is at the end, and they've gone, wow. And I've said, look, your name isn't on there. I'm just going to copy and paste it into your medical records, and the notes are as secure as your medical records, really. And so, yeah, the feedback's been really positive. And in terms of the consultation, it hasn't really changed for me because I never used to be a doctor who typed all the time, but it's really improved the accuracy of my note keeping and the detail that it goes into it. And you just pick up all those nonverbal cues, as I said earlier, that patients give out to you that you wouldn't see because, just otherwise you're just looking at the screen the whole time and not looking at them.
How about you, Jamie? What feedback have you had from patients?
Yeah, my feedback has been generally really, really positive. Thinking about patients perhaps that haven't consented to it, there's one patient I can remember, but generally everyone's been really keen and interested in it. I think more and more people are using AI now in their day-to-day work anyway. Most of my patients, when I mention it, say, "Oh yeah, we use that in our meetings to summarize." So the technology's out there everywhere. So I think everyone's level of comfort with it now is generally much higher. But I think the key thing is transparency. When my patients come into the room, I literally point to the microphone or tap on the microphone and say, I'm using this AI scribe today. I ask them if they'd like to know any more information about it. And generally, they're happy with that. And then afterwards, the patients some of them like to see the notes that are produced, and I show them. I say, look, the key thing is here. This is the scribe. It's producing a draft. I am going to then check these notes and change them. I can't think that I've ever just copied and pasted that note directly into the record. I think that's a really key thing for the patients to understand as well. It's not everything that's written in there that will be included. And yeah, that we do change, and we are responsible for the note that we save in the end.
And how about their experience? You said, you felt that you were giving more time back to them. Have patients said that to you as well, that they're enjoying having your attention more during the consultation?
Yeah, I did notice that. I think when I was doing one of our multi-source feedback collections from the GP college when I first started using it, and the patients that were involved definitely they commented on my presence. My listening was really good, and so there's definitely things that have shone through there.
Sam, what measures are you tracking to assess the impact of implementing Heidi?
When we first started, we to my earlier point, we were very academic about it, and it was really around, metrics around efficiency, accuracy, etc. The other things that are really important to us and that we are tracking is around job satisfaction. And when I say that, that's through our culture surveys that we run through the organization. And that's really important around how people feel that we're providing not just technology, but tools that assist them to do what they do and to do that well. And then one of the other things that we see through our net promoter scores, which we obviously measure across our clinics, is just the feedback that we're getting from patients. And that's really to Jamie's point around where people feel that they've actually got more time in the consult, feel that they're having a face-to-face conversation and then being listened to as well. And then to be fair, it's really a bit of a balanced approach. So it's a mixed bag of hard data, but it's also that qualitative feedback that you get from the clinic teams as well. So at the moment, we have roughly around 336 doctors that are actively using Heidi across the clinics. So that's a large number of clinicians, and that we've started piloting that across our nurses for triage and consults as well. So we're now starting to see quite a shift in the way that we're tracking that some of those metrics as well.
So just finally, if each of you can just tell me, where do you see AI scribes going in the future, and what's your hope for the use of Heidi at Tāmaki Health and within your own clinical practice as well? Do you want to start us off on that one, Jamie?
Yeah, so I guess at the moment it's just a very smart assistant really in the room with you that's drafting your notes. And so in the future, I'd like to see it producing perfect notes, that you just needed to quickly glance over and save, as well as just better integration with our PMS system. At the moment, I'm still having to turn back to the computer to print a lab form. Why can't an AI tool hear that I need that and just start doing it for me in the background? So that's all there for the patient during the consultation that I can just hand to them at the end, so just to free up even more of our time. So they're the sorts of places that I'd like to see it going. But primarily, really, like, we're all really busy. Our patients are having to wait longer to get in to come and see us. So we just need to make sure that in the long term, it's evolving in a way that's it's good to enhance the patient's well-being, but also just protect the doctor's well-being as well, as we're busier and busier.
Absolutely. And Slashna, what about you?
I would definitely echo everything Jamie said there. I think it's just only getting off the starting blocks, actually. And things like pre-populating lab forms, pre-populating radiology referrals, pre-populating ACC forms, work and income forms, off work certificates. The list is endless, really. And sending a text to the patient saying, this is a link to your consult, or with the portal, some practices, the patients can look at their notes, but sending them a link to website resources with regards to things that you've discussed in the consult would be really good, because at the moment we have to do that. And also integrating the technology that patients have at home, like information they get from their smartwatches or their diabetic meters or blood pressure machines and things like that. I mean, it's just endless, I think.
Certainly exciting. And finally, Sam, what's your thoughts?
Yeah, look, I think this has really become what I would say is a tool of the trade now. So I would imagine that any incoming clinician into a practice will probably have an expectation that an AI scribe is just in use and that it's available to them. So that's probably the first thing. The one thing that I'd say is that, as this evolves, the opportunity really for us is just delivering a better experience for patients and clinicians when they're in the room. But the pivot, I think, is just to the points that were raised earlier around it really just becoming an AI intelligent assistant that helps with the workflow. rather than just the scribe. So the scribe is ground zero, and that's where we're at now, but where it builds out into the future is endless. And I think that this is an investment in workforce well-being as well, not just a AI scribe and what it does. And I think that's really important, because that's around the quality and the care both ways for patient and clinicians. And then from, selfishly from a digital perspective, it's around richer data, the ability to automate from it, report on population health. I think there's definitely some opportunity for AI-driven clinical summaries that are used just prior to either meeting with the patient or that initial moment of that consultation. And obviously this technology is just simply very well placed to do that. And that will obviously come with the integration into evolution as well.
Thanks so much for joining me today, Sam and Slushna and Jamie. And many thanks to Heidi Health and Hendrix Health for sponsoring such an informative episode. So for listeners, be sure to like and subscribe to this podcast to make it easier for others to find it. And we'll see you next time. Mā te wā.